Come in.
Good afternoon,
Good
Mr.
afternoon.
Theron Lewis. My name is Fran Brown, and I'm a nurse here at University of Miami. I'll be doing your checkup today. Do you mind if I call you Lewis, Mr. Lewis, or Theron?
Mr. Lewis.
Okay, Mr. Lewis. May I have your date of birth?
9/15/93.
Okay, and do you know what today's date is?
Yes.
Okay, good. What's today's date?
Today is the 3rd
of
November.
Okay, good. Very good. Thank you. Now, what brings you to the doctor's office today?
A regular checkup.
Good. Very good. Now, before I do the checkup, which today we're going to do the chest and the stomach, we're going to be checking your lungs and all the organs in the stomach. I'm going to ask you a couple of questions, okay?
Okay.
All right. Have you noticed any recent coughs that you can't explain?
No.
Any shortness of breath?
No.
Any pain in the chest area?
No.
Is there any past medical history of lung disease? Did your mom have lung disease?
No.
Okay. Your dad or anybody in your family have lung disease?
No.
Okay. Do you smoke cigarettes?
No.
That's very good. Very good. We shouldn't smoke cigarettes. Do you live or work in an environment that affects your breathing? Like if some people work in a coal mine or they work in high altitudes where the air is really thin and it's hard for them to breathe. Do you have that problem?
No.
Okay. When was your last tuberculosis skin test?
A couple months ago.
Okay, good. Do you remember the date?
September the 3rd.
Okay, very good. And it was negative, right?
Yes.
Okay, I see it here in the paperwork that it was negative. Very good. Okay. Now, have you noticed any changes in your appetite?
No.
Okay. Any difficulty swallowing?
No.
Any foods that don't agree with you, that like upset your stomach or give you indigestion or bad gas?
No.
Have you had any stomach pains?
No.
Any nausea and vomiting?
No.
How often do you move your bowels?
Very often.
I know guys usually do it more often than females. Would you say about once or twice a day?
Yes.
About twice a day?
Yes.
Okay, good. Has anybody in your family have any diseases of the stomach or the intestines?
No.
Like maybe stomach cancer or anything like that?
No.
Okay, good. Are you taking any medications?
No.
Now, Mr. Lewis, I'm going to ask you, if you can recall, what I'm going to do now is call a 24-hour food diary, just to try to go over what you had for the past 24 hours. What did you eat for breakfast on yesterday?
I had grits and bacon.
Okay. And what, did you have a snack between breakfast and lunch?
No.
What did you have for lunch?
A sandwich.
Okay, what kind of sandwich?
Ham and cheese.
Good. Did you have anything to drink with that?
Yes.
What was it?
Water.
Good. Any snack between lunch and dinner?
No.
What did you have for dinner?
Pizza.
Pizza. What kind?
Pepperoni.
I like pepperoni too. Any snack after dinner?
No.
Oh, you eat very healthy. Okay. All right, so what I'm going to do now, I will step out of the room. That'll give you a chance if you can just take off the top part of your clothing, your shirt and any undershirt, because what I'll be doing is checking your chest and your abdomen, okay?
Okay.
Do you have any questions for me?
No.
Okay. I'll give you a minute and I'll come right back in.
Okay. Yes.
Okay, Mr. Lewis, thank you. Now, I'm just going to wash my hands. Now, what I have in front of you, just some of the things that I'll be using: alcohol pads to clean the stethoscope, and a pen light, gloves, of course. And I'll try to be as gentle. If I disturb you or bother you in any kind of way, if I hurt you or if it's taking too long, you just let me know, okay? We can always pause in between assessments, all right?
Okay.
Okay, so the first thing I'm going to be doing is checking your chest, which is also known as the thorax and lungs. So I'm going to be looking at your chest. It's symmetric, okay, which means that everything is even, which is good. The clavicle is symmetric and even. Everything looks good here. There's no lumps, bump, or bruising. I see you have a lot of tattoos, but other than that, the skin is intact. It is consistent with the patient's normal ethnicity and skin tone. Okay. Right now, Mr. Lewis's breathing rate is even and unlabored. He's not forcing himself to breathe. He doesn't have a hard time breathing. He's relaxed. His level of consciousness, he's awake, alert, and oriented ×3. And his posture is good. He's sitting a little slouched, but for the most part, the posture is good and relaxed. Are you comfortable?
Yes.
Very, very good. Okay. Right now, what I'm doing is called palpating. I want you to do me a favor. Take a deep breath in for me. And out. Good. One more. In. And out. Good. Okay, now what I just did, I confirmed the chest expansion with symmetry. I placed the hands on the patient's chest and have them breathe in and out. The hands go in and out like that. That shows symmetry. That's exactly what you had. That's what we look for. If there were any abnormalities, both hands wouldn't move like this. That means that both lungs aren't expanding. But you, perfect, okay? All right, now I'm going to check what they call tactile firmitus. What happens is, when you say the word 99, naturally everybody has vibrations that come through the lungs. Okay, so that's what I'm going to check for. I'm going to use the balls of my hands. Now just say 99.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Very good. Tactile firmitus is in check. If he didn't have the tactile firmitus, usually that would indicate some kind of a blockage or anything that needs to be further looked into. Mr. Lewis is in perfectly good health. Tactile firmitus is confirmed and bilateral. There are, again, no lumps, bumps, bruising, or tenderness. Does it hurt when I do this at all?
No.
Good. And his trachea is midline. Good. Okay, now what I'm going to be doing, I'm going to check for lung sounds by percussing. Percussing means just to tap, okay?
Okay.
All right. You let me know if I'm hurting you, okay?
Okay.
Now what I'm doing is checking for different sounds. Usually when I do this over the lungs, it gives me a more hollow sound than when I do it over bone. And I heard that exactly. What it's called is resonance. When I do this over the lung, resonance. Over the bone, it's dull. You see that difference now? That's what we look for. And you are perfectly good health. There's no hyperresonance. Patient's in perfect condition, okay? Now what I'm going to do is auscultate, which is also listen to lung sounds, okay? I'm going to wipe my stethoscope off with alcohol. I'm going to try to warm it up as much as possible, okay?
Okay.
All right. Okay, Mr. Lewis, I'm going to ask you to take a deep breath in and out. If you start to get dizzy or feel lightheaded or faint, you let me know, okay? We can always pause and start later, all right? Okay. So, finding my landmark. Take a deep breath in and out. Good. In. Out. Good. In. Out. Good. In. Out. Good. In. Out. In. Out. Good. 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 Very good. Okay. Mr. Lewis has equal and clear breath sounds in all the lobes. If you notice, I did more movement on this side than this side because on this side you have 3 lobes of the lung. On this side you only have 2 because of the heart. But even breath sounds, clear breath sounds, in all the lung fields, there's no adventitious breath sounds. Mr. Lewis doesn't have any barrel chest going on. His costal angles is at 90 degrees, which is perfect, okay? Now I'm going to check the lung sounds from behind, all right? If you could just turn a little bit, yeah, so I can get good. Very, very good. And the same concept. Inspect. Skin is smooth, intact. No abnormalities. Is there any pain?
No.
Good. Palpate. But that doesn't hurt, right?
No.
Good. Percuss. I'm listening for long sounds. Resonance over the... Good. I'm hearing resonance over the lung field and dullness over bone, which is exactly what we're looking for. Good. Now I'm going to auscultate. I'm going to ask you again to take deep breaths in and out for me, okay?
Okay.
Finding my landmark. Right here. Scapula's here. Right here. Take a deep breath in and out. Good. In. Out. In. Out. In. Out. In. Good. One more. Good. Now I'm going to listen laterally to the lung sounds. Take a deep breath in. Out. Good. In. Out. Good. Can you turn to the other side for me, please? Deep breath in and out. In. Out. Good. Very good. Okay. So Mr. Lewis has clear and equal breath sounds anteriorly, posteriorly, and laterally in the lung fields, okay? The spiny processes are noted here for Mr. Lewis. They're intact. There's no abnormalities. There's no kyphosis, no scoliosis noted posteriorly in Mr. Lewis. No barrel chest. Like I said, everything is equal and symmetric, okay? Do you have any questions for me, Mr. Lewis?
No.
Okay, now we're going to go on to the abdomen. I'm going to ask you to lay down on the bed, on the table for me, please. Just, no, good. Are you comfortable?
Yes.
Okay. Sorry about that. Okay, so right now what we're going to be doing is checking Mr. Lewis's abdomen. Okay, laying on his back, Mr. Lewis has what we know as scaphoid, which means that the stomach is concave, which is good, and women try and get it, but guys always have it, right? They have that flat stomach that we want. The symmetric of the stomach is smooth. There's no abnormalities. There's no pulsations. Everything looks even and symmetric, all right? I'm going to turn this light off and just shine the light right here. Good. Okay. No pulsations noted, which is excellent. That's what we look for. No pulsations, no anything. His umbilicus is midline and it's inverted as it should be. Nutrition seems healthy. We're going to test that by doing a skin turret test. We pinch and let go. That tells me your hydration and your nutrition status. Yours is good because it bounced right back. If it stayed tented or folded, then we would, be concerned. But you have no concerns. He's relaxed. He's positioned. He's laying down in bed, hands to the side, right? Okay. So now we're going to listen for bowel sounds. Mr. Lewis, you let me know if I'm bothering you, okay? So we're going to start in the right lower quadrant of Mr. Lewis's bowel. Again, make sure it's nice and warm for you. What I'm listening for are bowel sounds. Mr. Lewis has active bowel sounds in all 4 quadrants, which is very good, and that's normal to have in everybody, and you have that well. I'm going to check also and see if there's bruits noted in the aortic artery, which runs down towards here, towards the abdomen. And I do that by using my stethoscope also. No bruits noted on auscultation upon auscultation of the aortic artery, okay? Now what I'm going to do now is percuss, the same thing, just tap around. In the stomach, we listen for different sounds. We're listening for tympani, which is the sound that you hear usually when it's gas or air filled, which is usually what's inside of the stomach, right? That's over the bone. Good, that's the liver. That's the dull sound I'm looking for. Good. Okay. Very good. Now, Mr. Lewis demonstrated tympani over the abdominal region and dullness over the major organs, which I was able to listen to for the liver, and that's very good. And also dullness over the spleen. And I'm going to ask you to do something. Bend your knees for me. Just bend your knees in bed. Very good. And relax. Good. This forces the patient into a more relaxed position for this part of the assessment. And I'm going to do light palpation first, which is about 1 centimeter deep, and then I'll go on to do deep palpation, just in case we run into any pain or anything. We don't want to cause more pain than usual, right? Okay. So now light palpation started with the right lower quadrant of the abdomen. Good. No masses, no bulges. Does this hurt at all?
No.
Do me a favor, take a deep breath. Suck your stomach in. Good. Good. Okay, so I'm able to palpate the liver, the ridge of the liver. Let it out. Now, deep palpation. I'm going to go a little deeper, which is 5 to 8 centimeters. Again, no masses noted, no abnormalities, right? Feel any pain?
No.
Any discomfort? Good. Now, what I'm feeling for now are called thrills in the aorta. Again, right here. No thrills noted in the aorta. I'm going to ask you something. When I do this, does that hurt at all?
No.
Okay, no rebound tenderness noted. Usually, rebound tenderness would be indicative of, what's the name? Appendicitis. He does not have appendicitis or any signs and symptoms of appendicitis, and there's no discomfort noted with the patient. Do you have any questions for me now, Mr. Lewis?
No.
Okay, that concludes our exam. Thank you so much for being a great patient, okay? Have a great day.
You too.
Stop it.